Let's head to Queen's Park now, where the Ford government continues to signal change within its healthcare system.
Are we looking at options? Absolutely.
If there's a way of delivering better publicly funded healthcare, we're going to do it.
As the pandemic and funding cuts stretch Canada's healthcare system beyond its limits, there is a big push for increased privatization. Arguments for increasing private care provision are based on three principal myths: that privatization saves money, that it cuts down on long wait times, and that it increases service capacity. In a truly public system, public money is used to cover the real costs of care: doctors, nurses, hospitals, and supplies for everyone. In a private system, there's an additional cost: profits. The first step towards a private system is channeling public money to private institutions. Patients have a similar experience, but the system is drained of resources to pay for profits. As the quality of care degrades, pressure mounts to provide two-tier care where those who can pay more can jump the queue. We spoke to 3 doctors about what would happen if some of the private care proposals went forward.
The first step towards privatizing a healthcare system is not asking people to pay out of pocket for healthcare services. It's taking public dollars and starting to direct them more and more to for-profit care.
In reality, private systems raise prices and lower quality by introducing middlemen like insurance companies and for-profit clinics.
If we do start seeing more private pay healthcare, where people need to pay in order to receive care, we would start to set up a parallel system where people could, in theory, pay more for faster care. This would be supremely inequitable, and it would also really damage Medicare.
Whether it comes to private pay or it comes to private for-profit delivery of care, inequities get worse, wait lists in the public system get worse, and in fact, it can be quite dangerous.
A private system results in overpriced healthcare for those who can afford it, while the public system is drained of personnel and resources.
We have a very limited number of healthcare professionals in Canada. If we start inducing doctors and nurses and other healthcare providers to work in a private pay system, there's going to be less people to care for the vast majority of us who would rely on that public system. As I see it, there is fundamentally no way to have private pay healthcare that doesn't completely undermine Canadian Medicare.
A shift towards more private care institutions would in fact deplete the public system of essential healthcare workers that service the majority of Canadians, leading to a degradation of healthcare infrastructure.
And we've seen this in other countries. When there's been private parallel systems brought in, wait times actually worsen overall. For a select rich few, they might be marginally shorter, but I think we have to ask ourselves as Canadians, is that really what we value and is that what we want our healthcare system to be?